Let's discuss headache now. So, headache is basically a symptom rather than a disease and is defined as a pain or discomfort arising from the head areas like scalp, face, upper neck due to stimulation of the pain sensitive structures, right? So, whenever a patient presents with headache, the first step is to determine whether it's a primary headache, such as migraine, tension headache, or cluster headache, or a secondary headache caused by another underlying disease like sinusitis, meningitis, brain tumors, hypertension, or in some cases, trauma also. Now, let's discuss the common causes mentioned in this presentation, right? First of all, discussing sinusitis. So, in sinusitis, patient will come with a chief complaint of unilateral headache, which will aggravate while bending and massaging, right? Facial pain and pressure is also included in sinusitis. Patient will have blocked or stuffy nose, and thick discolored mucus is also seen in sinusitis, right? The second one, cluster headache. So cluster headache is mainly common in males. It is sudden, severe, and stabbing or burning type of headache, which is pain typically around one eye, right? In cluster headache, congested nose is also common. Now let's come towards migraine. So it is common in female, unilateral, and the pain duration in migraine is from 3 hours to 3 days, right? The migraine is basically throbbing or pulsating type of pain, and associated symptoms are nausea, vomiting, photophobia, especially phonophobia, right? Now let's discuss tension headache. So tension headache is bilateral and it is band like, or the tightness around the forehead is present in this case, right? And it increases in evening usually. Let's discuss about migraine and cluster headache in this video, right? So migraine. So as I said earlier, that it is basically common in female. Patient will come with a chief complaint of unilateral headache, common in middle-aged patients also, and patient will have a history of previous episodes, and it lasts from 3 hours to 3 days, right? Now let's come to the management of migraine. So during acute attack of migraine, I will write injection Toradol 30 milligram per ml, which is basically ketorolac, injection Mexolon 10 milligram per 2 ml, which is metoclopramide, and I will put both injection in 3 ml of normal saline, right? And now when the patients get stable, so for the chronic control, I will write Panadol 500 milligram TDS, 2 tablets, right? Tab Imigron 50 milligram, which is basically somatriptan OD. I will write Tab Indrol 40 milligram, half tablet BD, which is basically propranolol, right? And I will also write Tab Epiwal 500 milligram OD, which is sodium valproate, right? Now let's discuss about cluster headache. So patient will come with the chief complaint of retroorbital pain. It is pain around the eye, lacrimation, and congested nose, right? So for the management is concerned, I will put the patient on oxygen inhalation for 15 to 20 minutes. Then I will write lignocaine nasal spray, which is basically local anesthetic. I will write Panadol 500 milligram BD, 2 tablets, right? And so far the prevention is concerned, I will put the patient on steroids, that is Tab Deltacotril or Repicot, 5 milligram, 4 tablets on the spot, right?